Hello, this is a day 12 update on Friday, August 29th. I was taken off the 24-hour chemo on Monday and around 5 p.m. And at that time I was still basically feeling decent, maybe a little bit weak or something, but there was really no extreme obvious effects. I couldn't go running or something like that, but I was having no trouble walking around and that kind of thing. And then Tuesday kind of started feeling more of the more noticeable symptoms of chemo. So for most of this week, it's been dealing with those symptoms, basically like GI issues, flu-like aches, and weakness, joint pain. It just makes me feel like an old man, but it's honestly not that bad. It's kind of like having the flu, but without like all the heavy sweating and fever and stuff. I actually did spike a small fever. Last night it was like 100.6, which is the point at which they start giving you IV antibiotics and stuff. So they came in and did a chest x-ray and started giving me IV antibiotics, and that was good, I guess, because this morning my fever was basically gone. So it's well under control. I managed to put in a full week of work this week, so I won't feel bad if I have to take some time off this coming week, just for recovering. My nadir is going to be on around Monday, so the nadir is like the lowest point, or roughly at the point at which my immune system will bottom out. On Wednesday, my white blood cell count was around 0.9. Yesterday it was 0.6. Today it's 0.3. So it seems to be trending downward exactly like they want it to. My hemoglobin was 9.2. Today, and platelets are around 9,000, so I just finished getting another transfusion of platelets, which is good. I accidentally hit my head going into the bathroom the other night. There happens to be a towel rack on the inside of the door exactly at head height, so for better or worse, that was somewhat aggravating just because it's like not a fun way to wake up. But it is not serious. And what else? My doctor mentioned that they'd taken a look at the white blood cell count, or the white blood cells in my blood from earlier this week, and the ones that they saw that were there seemed to look normal, which is it's an encouraging sign. When I originally had the biopsy done, my oncologist could easily see that the white blood cells looked abnormal under a microscope, so those were part of what indicated MDS or leukemia. So the fact that whatever white blood cells I do seem to be trending towards a normal appearance indicates that the chemotherapy has probably been at least somewhat effective in prohibiting the cancerous cells from reproducing. Trying to think. It's basically it. Kay's been great. My dad's been coming in most nights, and between she and my dad, they've been keeping me well supplied with tasty victuals. We had Watt's Grocery last night for dinner. That was nice. I had pork belly with clams, which was suitably rich. If any college students in the area are interested in an entrepreneurial opportunity, I'd suggest that a food delivery service to the hospital from the local area could probably be a fairly successful service. From what I've my own experiences and from what I've talked with the other patients and staff, there's about 900 beds here, and I think 8,700 staff, and probably a bunch of other inpatient and families and stuff. And the food options are somewhat limited. To put it diplomatically, and fortunately Durham is a fantastic place to find good food. So if you want to make some money, there's potential there. And yeah, I guess I wanted to give a quick update for anyone who was curious how I was doing. Not feeling so great, but that is to be expected. It's not like I'm dying or anything. It's just like it's just like and it'll probably start getting better, I'm guessing, next week. So my throat sounds a little weird just because it's a little sensitive. The chemotherapy just basically affects all the fast reproducing cells in the body, including the lining of the throat and GI tract. So anyways, thank you very much for your support and thoughts, and I'll try to keep another update sometime when there's information worth updating. Oh, I have a biopsy on Tuesday. And the biopsy basically will determine how effective the chemotherapy has been and the future course of treatment. So I'm sure there'll probably be an update then. Fingers crossed, it'll look good. Otherwise, there's probably still lots of options in terms of consolidation chemo or that kind of thing. So, all right, peace. Ken?